and a very good afternoon to all of those who are watching me live on the Facebook page of News9. I'm Neha Bhan. Today we're going to talk about COVID-19. Yes, of course, we have been speaking about this for all this while, but what's special today? We all know that coronavirus has wreaked havoc across the globe. Many people have lost their lives to this deadly pandemic, while many others are fighting for theirs. Coronavirus quite literally has redefined our lives and forced us to live with discipline. We're going to speak about how exactly COVID-19 has changed for the world in the past 6 months. Yes, you heard me right. In December, the entire world got to know about the outbreak of this invisible enemy, COVID-19 or coronavirus. But before we go to that, now let's talk about what's the situation like across India when it comes to COVID-19. The active cases in the country stand at 1,10,960. While the silver lining is, of course, the people who have been discharged. Over 1 lakh people have already been discharged. To be more precise, 1,09,461 people have been discharged. Unfortunately, 6,348 people have succumbed to this deadly virus. And the confirmed cases in India stand at 2,26,770. Today alone, a record spike of 9,851 cases was reported, while 273 deaths came to light in just the last 24 hours. So from 0 to 1 lakh, India took 110 days, while from 1 lakh to 2 lakh, India just took 15 days. And of course, the trajectory, the COVID-19 trajectory is just moving upwards and on expected lines, because do remember what the AIIMS director, Prime Minister or all the health experts have been saying. They have been continuously saying that the COVID-19 cases will see an increase till the month of June to July, and after that perhaps there might be a decline. If we have to speak about the cases in Karnataka, well, 257 fresh COVID-19 cases have been reported in Karnataka till last evening. Do remember that there is no midday situation update that we will be getting from the health ministry side, given the fact that there was in fact a statement given out that there will be only one COVID-19 update that will be given out from the health ministry side, and that too will only be in the evening, given the fact that there have been a steep increase in the number of cases in Karnataka that we're witnessing. So the total tally of the state right now stands at 4,320. While the death toll due to COVID-19 in the state has also risen to 57, with 4 new deaths being reported. The active cases stands at 2,651, out of which 13 people are being treated in ICU. So if we have to talk about our today's topic, what exactly has changed for the world in these 6 months? Well, 6 months and more than 6 million people have been infected with COVID-19 worldwide. US continues to remain worst affected with over 18 lakh cases, while over 10 lakh people have succumbed to the deadly virus. Speaking about the phase in COVID-19, of course, we all have been living with this pandemic for quite some time now. So what exactly has changed? Well, masks have become a part of our daily routine. Many of us, all of us, are not stepping out of our residences without wearing masks. That's something that we have to do for ourselves. We have to make sure that we're taking all the preventive measures to keep the COVID-19 enemy far away from ourselves. So social distancing, another factor here. Of course, maintaining 6 feet distance is also something that we will be following for a very, very long time. Now, if you have to talk about, why is it that social distancing was given or has been given utmost importance? Because of the fact that COVID-19 primarily spreads from person to person. It is extremely important to maintain 6 feet distance or, follow social distancing. Now, do remember that a vaccine is still a distant dream. Of course, trials are underway in many countries to find a vaccine. Crores of money also has been pumped in, but no country has found any luck when it comes to, the vaccine, of course. And do remember that WHO also very explicitly has said that WHO Emergencies Chief Mike J. Ryan has also said that this disease actually may become an endemic, and we may have to learn to live with the virus for the rest of our lives, which means that the virus is going to be here, just like HIV or smallpox. So the infection, of course, of virus results in symptoms like breathing problem, fever, your cough, cold, loss of taste, etc. Now, there was another, theory that was being discussed widely, and that was about climate change. But this has been proven that it doesn't really have any effect on COVID-19. There were several studies which suggested that COVID-19 will not be present at places where there is warmer temperature. But of course, putting that to rest, now we do know that climate change does not have any impact on COVID-19. All in all, we may have to live with the virus, as the WHO also has suggested, for a very, very long time. Disciplined living is the only way forward. Now, to speak more on this, I have with me Dr. Satya Narayana, a doctor from Manipal Hospital. Very good afternoon to you, Dr. Satya. Hope you're doing well. Now, if you have to speak about, COVID-19, do tell us what is the way forward for all of us, for how long possibly we have to live with this virus, which has claimed lakhs of lives across the globe.
Thank you. Thank you for the invitation. So, is there light at the end of the tunnel is what we are precisely being asked. First of all, the peak of the pandemic is yet to be reached. We expect June end and July for the peak of the pandemic to happen. Second, once the peak, there may be a chance of a second wave, which may be smaller in impact. But then that would drag it almost, towards September. So after September is the question, what is the way forward? Absolutely. There may be pockets of corona, COVID in, endemic state. Therefore, we need to come up with what should be the likely scenario, what could be the way of life. The service industry, health industry, consumer behavior, corporate and domestic travel, international travel will all be affected. Air travel and domestic travel may more look like as if we are traveling by an ambulance. Earlier we used to, match the tie with the dress. Now people may end up matching the mask with the, attire. So that is the kind of scenario we are looking at. This is much better than letting a free reign of, the COVID situation to go on. Our country has done well, barring a few pockets of, could not achieve physical distancing or, rush in the migrant worker category. Otherwise, there has been, kind of a strict discipline everywhere, which we are happy about. So the way ahead is caution and care. These are the two key commandments in the way ahead.
All right. So, Doctor, will we get to see a vaccine? And if yes, then when? How long will it take? Many countries have been pumping, like I earlier as well mentioned, a lot of money, but no results have been seen so far.
No, there have been results, but there are about more than 114 vaccine trials enlisted in the clinical.gov, the registry where all these vaccines are, registered in one place. Moderna is leading the pathway. Moderna vaccine could be out there fast, but the question is, we are all eager for a vaccine to come out.
All right,
people,
but doctor,
patients.
All right, speaking about hydrochloroquine, now a lot has been said when it comes to the drug, but recently WHO stopped the trials and they've started the trials again. What's the truth behind hydrochloroquine?
So basically, on the 22nd of May, there were 2 or 3 very reputed journals that brought out studies involving huge number of patients on hydroxychloroquine. Now, the data for these trials were supplied by a particular data source company. When people looked at this trial, these trials basically said the harm is going to be much more with chloroquine. They said, point number 1, it doesn't work. Point number 2, there is a harm, cardiac side effect and things like that. So basis this, when people read through the trial, it was quite evident that the numbers did not match when you break it up country-wise. When this was challenged and the journals actually retracted, expressed a concern, expression of concern, and all those articles have been taken out. So we don't have a real data. So that is where the controversy comes in.
All right.
WHO, what they did was a knee-jerk reaction. We are happy that they have reinstated these clinical trials again. They have given a green signal for further trials on hydroxychloroquine to continue.
All right. So, Dr. Satya, what is it about the masks? So, there has been a lot, said when it comes to wearing of masks. So, is it important? Is it not important?
It is quite important in a pandemic. Earlier view was only healthcare workers should use the mask, and that was endorsed by WHO and CDC Georgia. But then, in the middle of pandemic, there was a kind of thinking that if I wear a mask, the chances of me infecting somebody comes down to less than 5%. But if I wear a mask and somebody else in front of me wear a mask, the chance of infection comes down to less than 1.5%. Now, add to this physical distancing that I see a patient from a distance of, meter at least, then the chances of infection becomes almost, towards zero.
All right.
So, the mask is quite important.
All right.
And the mask is here to stay.
All right. Just like COVID-19, I believe. Dr. Satya, I have a last question to ask you. So, would the world be in a better position when it comes to handling of crisis if at all China has been, let's say, more transparent, had been more transparent in giving out the details to the world?
Equally so. It would have been definitely better had China been forthcoming, but equally so WHO needs to answer, and that is why the US President is going very hard on WHO. Take the recent example. There was no requirement for a knee-jerk reaction and actually closing the trials or halting the trial, and then 2 days later jumping back and reinstating the clinical trial. So I guess China and WHO will need to come clean and answer. But then this pandemic has taught a very good lesson, I should say, but at a very high cost in terms of life and economic. But then the blame has to be taken and an internal audit should be done at the level of WHO.
Right. Sir, quickly, if you could tell us what are the habits that we need to inculcate in our daily lives given the fact that COVID-19 perhaps is here to stay?
5 commandments: physical distancing, wear mask, follow cough etiquette, don't cough out in the open, hand wash, and the last one is taking care of our own health and preventive medicine. And there is hospitals are safer till the peak of the pandemic. Therefore, do visit your doctors if there is any health condition unrelated to COVID. Get it treated. So these are the 5 commandments, I would say.
All right. Thank you very much for your valuable time, sir. We completely understand that you must be very busy. Thank you so much for taking out some time for us and speaking to our viewers, giving some clarity over COVID-19. Thank you very much. And I hope that you're safe. Well, I really hope that this information was very helpful for all of you. And do remember that, yes, there have been relaxations announced in the, restrictions that were earlier imposed. We have now stepped into unlock, but it doesn't really mean that we can undermine the threat that COVID-19 poses. Do remember that India has not yet seen its COVID-19 peak. If at all you like this video, please do not forget to subscribe News9 YouTube, like us on Twitter, Facebook as well as Instagram. Thank you very much for watching. Stay safe.